Welcome to Rockhill Women's Care, and congratulations! Our physicians and staff look forward to taking care of you during your pregnancy. As your maternity provider, we wish to share what you can expect from Rockhill Women's Care over the course of your pregnancy. We hope we answer all of your questions. In the event that we do not, our patient care staff will happily answer remaining questions at the end of the video. Of course, you can always discuss and review topics in depth with your physician during each office visit. Meet our obstetricians. All our doctors are board certified or eligible and excellently trained in normal and high-risk obstetrical management. We follow a group practice model. You will see your selected physician for the majority of your prenatal care. However, at time of an emergency, should one arise, or for delivery, you will see one of our other qualified on-call physicians. Today marks the start of your prenatal care at Rockhill Women's Care. We will obtain and review your medical history, draw routine labs, and answer your questions. Blood lab work includes blood type, antibody screen, blood pregnancy test, CBC, rubella, and screenings for hepatitis B, syphilis, and HIV. A urine specimen is used to test glucose and protein to diagnose diabetes and preeclampsia. To properly evaluate the specimen, please let us know if you suspect you have a bladder infection. You will conclude today by scheduling your first appointment with your physician. At each of your visits, we obtain your weight and blood pressure. We also measure the height of your uterus to determine the growth of the baby and listen to the baby's heartbeat. We also check your urine for protein and sugar. Everyone's favorite visit is when they get their ultrasound and can see their baby. A first trimester ultrasound will be ordered unless one has already been performed. We can date the pregnancy from this ultrasound. We schedule a second ultrasound at 20 weeks to evaluate the baby's organs and growth. If you decide to know the gender of your baby, this ultrasound will provide that information. In the first trimester, we offer an optional first trimester screen to check for genetic conditions such as Down syndrome, trisomy 13 and 18, and Turner syndrome. First trimester screening is performed at a perinatologist office, and diagnosis is based on ultrasound and blood work results. A quad screen is another optional test in the second trimester, which evaluates probability for Down syndrome, trisomy 18, and spina bifida. It is performed on maternal blood and may be drawn in our office. There are other tests that are performed during your prenatal care. These include a screening test for gestational diabetes and Group B strep swab. If your blood type is negative, you will receive a RhoGAM injection at approximately 28 weeks. There will be an opportunity to speak with a genetic counselor as indicated from your provider. 2 vaccinations are recommended in pregnancy to prevent harmful illnesses. The Tdap vaccine is given to expectant mothers at 28 weeks to protect the newborn infant from whooping cough. Whooping cough is very contagious and can be fatal to infants. The flu vaccine is recommended for all expectant mothers during the flu season. Pregnant women are at a higher risk for developing severe cases of influenza, which may require hospitalization and may even cause maternal death. We are frequently asked to answer the following questions. Morning sickness is very common in pregnancy. It can occur in the morning as well as during the afternoon and evening. Eating 6 small meals per day instead of 3 large meals to keep something in the stomach helps with nausea and vomiting. Drinking fluids helps prevent dehydration. Avoid junk foods that are low in nutrition and energy support. Some women do not like the taste of water during pregnancy and prefer to add lemons, limes, and other fruits to flavor the water. Some do not like the taste of their own saliva, and mints or gum can help with this. If you are unable to keep food or fluids down for 24 hours or more, it is important to contact our office. there are medications that may be prescribed to help alleviate symptoms. It is important to eat a well-balanced diet while you are pregnant. This includes fruits, vegetables, whole grains, calcium-rich foods, and lean meats. If you are vegan or a vegetarian, you should increase your intake of protein-rich foods such as legumes, nuts, and tofu. Listeria is a bacteria that can be found in undercooked meats and unpasteurized cheeses. Please avoid these items throughout your pregnancy. The effects of listeria can be severe for pregnant women. It is important to handle, clean, cook, and store food properly. When you handle raw meats, wash your hands thoroughly with soap and water. It is advised during pregnancy to exclude some specific foods that might cause foodborne illnesses. This includes smoked seafood, meat spreads, or deli meat from the prepared food counter. Salads made with mayonnaise, such as chicken, egg, or tuna, are not recommended. If you make them at home, eat them soon after preparation. Also avoid raw or undercooked meats and sushi containing raw fish. If you choose to eat deli meat, it should be heated to a steaming hot temperature. Avoid raw or unpasteurized milk and soft cheeses such as feta, brie, camembert, blue-veined cheeses, and queso. Fish and other protein-rich foods have nutrients that can help your child's growth and development. However, some types of fish should be avoided due to the high mercury content. These include tilefish, king mackerel, marlin, orange roughy, shark, swordfish, and big-eye tuna. We provide a list of the best choices for fish in your OB brochure. As a general rule, most things in pregnancy are safe in moderation. This includes caffeine. We suggest limiting your caffeine intake to no more than 200 milligrams per day. As an example, 12 ounces of coffee is equivalent to 200 milligrams of caffeine. Excessive caffeine intake may lead to complications with your pregnancy. We do not recommend the use of alcohol at any time during your pregnancy. It is proven that alcohol causes fetal alcohol syndrome. It is unknown what a small amount will do, so it is best to avoid it altogether. Why take a chance? Smoking increases the risk of the baby being born too early or having a low birth weight. Using e-cigarettes or vape pens can be just as harmful. If you are unable to quit smoking, we recommend that you reduce the number of cigarettes you smoke daily. We do not recommend the use of any recreational drugs during your pregnancy. Some prescription drugs are allowed. These will be reviewed with you by your physician at your next visit. If you see doctors outside of our practice, be sure to tell them you're pregnant so they do not prescribe anything harmful to your pregnancy. There are numerous over-the-counter medications that are safe to take during pregnancy. A complete list of safe medications will be provided today. If you would like to take a medication that is not listed, please check with us first. We recommend taking prenatal vitamins throughout your pregnancy. They provide important nutrients and folic acid, which helps prevent birth defects. DHA helps with brain and eye development. Take 1 prenatal vitamin per day. You do not need to take additional supplements to these vitamins. There are some prenatal vitamins in your new mom handbag. We can call in refills for the prenatal vitamin you prefer. Bear in mind, you do not need to take a prescribed prenatal vitamin. Over-the-counter vitamins are just as effective. We recommend that you speak to your doctor before deciding. Most women are concerned with how much weight they should gain during their pregnancy. These recommendations are based on your body mass index and are determined by your current height and weight as recommended by the Institute of Medicine. The average weight gain is approximately 25 to 35 pounds for women with a normal BMI. Women who are underweight may be encouraged to gain slightly more. Overweight women may be counseled to gain less. Your target weight gain will be determined at your first visit with your physician. We recommend that you exercise throughout your pregnancy. Exercise can prevent excessive weight gain and maintains your health. If you are experiencing a healthy, normal pregnancy, it is safe to start or continue most types of exercise. However, you may need to make a few changes. Speak with your doctor to get personal recommendations for exercise. We recommend 30 minutes of daily activity. Avoid laying flat on your back after the first trimester, and avoid raising your heart rate above 140 beats per minute for an extended period of time. Also avoid any activities where you have a high risk of falling and injuring yourself. Prior exercise routines may be resumed gradually postpartum as soon as it is safe. We recommend that you not handle any kitty litter or pet rodents such as guinea pigs or hamsters to prevent exposure to toxoplasmosis. This is a bacteria that could harm you and your baby. There are no issues with taking care of dogs. The best time to travel is during the second trimester. You may travel in the first trimester. However, keep in mind that the majority of miscarriages happen during this time. You may have to seek care away from home should you have any complications. Most airlines allow pregnant women to travel up to 35 to 36 weeks. However, if you travel in the third trimester, you may end up delivering away from home. Avoid travel to areas with active Zika virus. Please refer to the CDC website for the most up-to-date information on these areas. Be sure to inform your provider if you are exposed to the Zika virus. Travel is not recommended for women who have medical or obstetrical complications. After your baby is born, there are a few things to keep in mind. We encourage breastfeeding your baby. Even a short amount of breastfeeding reaps benefits to mom and baby. It helps prevent infections in your newborn, and it also contributes to postpartum weight loss. You will burn approximately 500 calories a day from breastfeeding. We recognize that breastfeeding is a personal decision and it is not for everyone. For a complete list of breastfeeding benefits, please reference the OB brochure. Shaken baby syndrome is also known as abusive head trauma. It is a serious medical problem that results when the baby is violently shaken and can result in fatal injuries. Be careful when choosing any care providers for your child. Make sure care providers know the dangers of shaking and that they have permission to call you anytime. If you have thoughts of harming yourself or your child, this could be a sign of postpartum depression. Speak with your doctor to get appropriate recommendations. Throughout your pregnancy, we encourage you to reference our website. It may answer frequently asked questions and point you to other resources. The patient portal provides access to your chart. You will receive notifications when your labs are back and you can review your lab reports. Should results be abnormal, our office staff will call you before posting the results. You can also send a secure email to our staff through the patient portal. Emails will be answered during normal office hours. If you have an emergency, it is best to contact the office by phone. If you are new to our practice, you will receive an email with your username, temporary password, and a link to the patient portal. If you need assistance setting up your patient portal or cannot remember your password, please notify a nurse. Our patient care staff will be happy to answer any additional questions you may have about your pregnancy and obstetrical care. You can reach a nurse during regular office hours. If you have an emergency after office hours, call our main office number. You will reach our answering service and they will relay your message to the on-call physician who will return your phone call. Please call your pharmacy for prescription refills. Once again, welcome to Rockhill Women's Care and congratulations on your pregnancy.